Hello, Dr. Lee. Thank you for joining us today. You have an illustrious career over several decades. For those who may not be familiar, could you start by telling us what inspired you to get in the industry and a little bit about your history in the industry?
Okay. When I was in medical school, I had intended to be a general practice doctor and do medicine. But when I went into psychiatry, I realized that that was my field. And I have been blessed with being able to really enjoy being a psychiatrist. I thoroughly enjoy being a psychiatrist, and it feels like that's what I was supposed to be doing. So I started off as Emory faculty, having a joint faculty appointment in OBGYN and psychiatry. And did that for a while, and then I got into adolescent psychiatry. And for the first 20 years after being in Emory faculty, I worked only with adolescents, and it was inpatient adolescents, and really enjoyed doing that. Then I ended up going into more of an administrative psychiatry, being medical director of different hospitals, and along with that, a lot of consultation liaison with medical services at general medical hospitals, so that I was helping people that had medical problems to deal with their medical problems and their psychiatric illness. Part of that had to do with chronic pain management and working hard with trying to help people with pain, and that helped me to understand more about addiction with alcoholism and opioid use disorder. And so as my career evolved, and I ended up coming back to Ridgeview. I had actually been a physician here at Ridgeview since 1981, but I came back to Ridgeview and became the medical program director of outpatient services and the director of addiction services. And so that's what I've been doing here essentially for the past 10 years, and thoroughly enjoy what I'm doing.
Awesome. Well, thank you for that. So, again, I mentioned you have such an illustrious career. If you don't mind, brag on yourself a little bit and give us a few of your accomplishments or highlights from your industry, or excuse me, from your experience that you're most proud of.
Well, other than the things I've said, when I was at Emory as faculty there, I really enjoyed that, and enjoyed supervising and teaching students. I have become the medical director of several hospitals. I was medical director here at Ridgeview several times, medical director at Peachford Hospital and Summit Ridge. And that entailed being connected with national organizations to really understand the standard of care for psychiatry, and that was very helpful in terms of our programming here at Ridgeview, as well as my overall treatment of the patients. I think understanding the full range of psychiatry in terms of addiction, in terms of the medical nature of problems, geriatric psychiatry, psychoses, depression, and adolescent work is just given a fullness of psychiatry for me that I've really enjoyed.
Awesome. Well, thank you very much for that. So why have you chosen Ridgeview as your home, and what do you think makes it so special?
I feel like at Ridgeview, I've been able to do this full range of treatment, from inpatient, working with the patient on an inpatient unit and stabilizing the acute episode, and then take them into a structured outpatient treatment in our PHP IOP program, and and then to take them into outpatient treatment in my office. Um, Many hospitals, I believe, do not provide this continuity of care that I have been able to do here at Ridgeview. They may be more focused on inpatient, or they may be focused on other things. But I think at Ridgeview, we do have this full comprehensive treatment so that people get what they need.
Awesome. Well, thank you for that. So, what are some of the changes that you've seen in substance abuse and behavioral health over your career, or also within the last couple of years?
When I started in psychiatry, most addiction was alcohol use disorder, that being an alcoholic. There were some people doing opioids and things, but what's happened over the last 10 years in particular is the expansion of addiction into more of a polysubstance addiction. People are using opioids, they're using crack cocaine and methamphetamine as stimulants. They're drinking alcohol, and then of course marijuana is a major issue with all of that too. So I think, and of course with COVID, a lot of people were isolating, and that just made their addiction much worse. The problem is that even though it's made addiction much worse, people are not getting the treatment they need to get. Many people are not coming in for treatment, and they need it. They need treatment, and it is available. The Ridgeview provides a free assessment. People can come and be assessed about whether they have a problem. If they do have a problem, what the recommendation would be. And I feel like the assessment is accurate and appropriate. So really encourage people to seek the help they need.
Great, that's great advice. Thank you. Now, would you say that there has been an increase of substance abuse in America over the years?
I believe there's been some increase since COVID. I believe that there's been some increase with young adults and adolescents. But in general, addiction is pretty close to what it's been over the years. It's just that it hasn't been recognized as the problem that it is. It is a very serious problem. It is a life and death problem. And if people don't get help for their addiction, they'll end up dying with their addiction. It's very serious. I think in the 50s and 60s and 70s, we minimized it, just like we minimized smoking cigarettes and things like that. And it just became part of our culture to be drinking and smoking cigarettes. And when actually both of these things are very dangerous. And I think over the last 10 or 20 years, our society has more knowledge about the dangers of addiction, and I think people are more aware of the need for treatment, but they're not following through with it.
Yeah, that's great. That's great information. Thank you. So, what would you suggest for family members as far as how they can support someone that they know who is struggling with substance abuse or behavioral health?
Well, the first thing they need to do is to communicate to their loved one that they're concerned that they have a problem. And many times their loved one will push back and either minimize it or deny it. They need to become more educated about what addiction is and what can be done about it. So you can get on the internet and you can read a lot about what is alcoholism, what is opioid use disorder, and get a better understanding. And then to approach the loved one again. If the person, the addicted person is still resistant, then the family member needs to get into either Al-Anon or Nar-Anon. Now, Al-Anon is an organization, 12-step organization, which is free. It's on the internet. You just look up Al-Anon, and you go to these meetings, and you're there with other people who are struggling with the same problem, and they will help you to take different approaches, how to manage it, how to deal with it. And if your loved one is on something other than alcohol, there's Nar-Anon, which is Narcotics Anonymous, and that's involved with Narcotics Anonymous, and it's the same thing. You're there with family members who are doing the same thing.
Awesome, thank you. That's good information. Now, what would you say for like a friend or a colleague or like a coworker? What should they do if they recognize that someone may be struggling with substance abuse or behavioral health?
Well, it's very similar. You know, you have to, if you're concerned, you need to say something. And if the person takes offense to it, you have to then try to help them to understand that you're saying this because you care about them and you care about your relationship with them, that you can see that something's not right. And either they're drinking too much or they must be using something. And but if the person is not receptive, then you have to back off from that. And depending on how close you are to this person, you also can go to Al-Anon or Nar-Anon. I mean, you can do that yourself, and that will help you to understand more about how you can approach your friend to help them to see that they need treatment.
Awesome, thank you for that. So last question, is there anything else that you would like to speak about or discuss?
I think the biggest thing is addiction and psychiatric illness are serious medical problems. They're as serious and potentially as deadly as any other medical problem, and they need to be treated. And what I'm finding is that people feel ashamed that they have it, or people feel that they minimize it. They feel like they should handle their problems by themselves when that's not true. I mean, they need professional treatment. These are illnesses that you cannot treat by yourself. It'd be like trying to treat diabetes or high blood pressure or even cancer by yourself. And you can imagine where that goes if you don't get treatment. And so it's critical that you get treatment. You can come here to Ridgeview and have an assessment, and then they can tell you the range of treatments that are available. It doesn't mean you're going to be put in the hospital. You can go to your family practice doctor, who are now, most family practices are more educated about psychiatric illness and addictive disease, and they can give you some direction about what to do. But you need to get professional help. This is not something you can handle by yourself.
Awesome. Well, that's great information. I want to thank you for your time, Dr. Lee, and we'll conclude there.